All right, let's dive right in. We're going to explore a connection that's, well, often the missing piece in a doctor's office, but it's absolutely fundamental to our well-being. We're talking about the link between our inner world and our physical health.
But first, I want to start with a question. And I bet a lot of you have felt this at some point, sitting in a hospital or a waiting room. With all the incredible high-tech stuff we can do now, are we accidentally leaving something crucial behind? Is modern medicine maybe losing its human touch? To figure out where we're going, it helps to look at where we've been. And it turns out this whole idea, this link between our spirit and our physical health, it is anything but new.
I mean, think about it. For literally thousands of years, across pretty much every culture you can name, the act of healing was never just about the body. No way. It always involved the mind, the spirit, the whole community. This idea that our sense of purpose and how we feel physically are connected, that's some of the oldest wisdom we have.
Okay, so before we go any further, it is so important that we get on the same page about one particular word: spirituality. For a lot of people, that word immediately brings religion to mind. But in the world of modern healthcare, they're actually seen as two very different things.
So what are we really talking about here? Well, spirituality, in this sense, is just that universal human search for meaning, for purpose. It's that feeling you get when you feel connected to something bigger than just yourself, whether that's nature, humanity, or even just a personal sense of wonder. It's the why that gets you out of bed in the morning,
And this really shows the key difference. See, religion often comes with specific doctrines, communities, and rules. But spirituality, that's deeply personal. It's a universal experience you can find in every single culture, and it's all based on your life and your experiences. It's not about a specific belief system, it's about a fundamental human need.
So this brings us right to the heart of the challenge facing medicine today. We're living in an age of absolute medical marvels, but all of these incredible advancements, well, they can come with an unexpected cost.
And here it is, plain and simple. The more specialized and technologically amazing our medicine gets, the higher the risk that it starts to feel, well, mechanical, impersonal. The focus can so easily shift from the whole person to just the disease, from the patient to the patient's chart.
Now, what's crucial to get here is that this isn't intentional. Nobody wants this to happen. It's just a byproduct of progress. As medicine gets more and more specialized, and as technology puts more layers between the doctor and the patient, those essential parts of healing, like compassion and empathy, can kind of get pushed to the side.
So if that's the dilemma, where do we find the solution? Well, it comes right back to reconnecting with that human element, especially when people need it the most. It really is all about the power of support.
And think about when this matters most. We don't go to the doctor when we're feeling great, right? We go during times of intense stress and crisis, when we're facing a chronic illness or watching a parent or a child get sick. And those are the moments when a purely technical approach, it just isn't enough. And this is exactly where that universal idea of spirituality becomes such a powerful tool. It helps patients in three really profound ways. First, it helps them cope with their suffering. It can shift their focus from, why is this happening to me, to, okay, how can I find the strength to get through this? Second, it fights that deep sense of isolation that illness can bring. It reminds them they're still part of a larger human story. And finally, it helps them find a higher meaning in their experience, maybe turning a personal struggle into a story of resilience. And you know what's really cool? We're already seeing this shift. Leading medical schools are actually teaching spiritual care now, training doctors to ask about a patient's sources of hope, not just their list of symptoms.
So where does all this leave us? What does it all mean for the future of healing? Well, it points toward a vision of healthcare that's more complete, more holistic, and just more human.
This quote just says it all, doesn't it? True, deep healing isn't just about curing a disease or fixing a bone. It's about addressing the whole person. And that includes our fundamental need to find meaning, especially when we're facing life's biggest challenges.
And that leaves us with one final, crucial question to think about. As we keep pushing the boundaries of medical science, maybe we should start thinking of compassion not as a nice-to-have, but as an absolutely essential part of the prescription itself. Something to ponder. Thanks for watching.